Hello and welcome to a Business Minute with Lily Lopez, presented by the South Florida Hispanic Community. Today we're celebrating our 15th annual Heart Disease Awareness Lunch Conference. And with me is one of our regulars. We are honored to have him here, Dr. Joseph Ramirez, who's with NCH. And he has, his area of expertise is the minimally invasive surgery, right? Tell me a little bit about that before we continue talking about your role now at NCH. Because for many years you were here, you were in Austin, Texas. You've been all over, Dr. Lamelas. Everybody wants you.
Yeah.
That's what it is.
It's always a pleasure to be here. I think I've been here for the last 10 years. I mean, I can't remember now. It's been so long, but it's always an honor and a privilege, and always it's great to be with you. You have so much energy, and you've done so much for South Florida that it's truly an honor to be here with you. So as far as my role, I moved to NCH in Naples, which is Naples Comprehensive Health, in order to truly, for the first time in my career, build a minimally invasive center of excellence, which is a reference center. So what that means is that patients will come from all over the world to have minimally invasive surgery. And basically what that is...
Yeah, could you explain minimally invasive? Because I read so much about it and about what you do, but what does it mean that you don't open the whole...
That's correct. So conventionally, heart surgery is done by opening...
My father had that many years ago, and it was big. It was bad.
And that's cracking open the chest. But now, in the last 25 years, I've been on a journey to perform lesser invasive surgery for the heart, because the minimally invasive surgery started with OBGYN and with urology, but now we've expanded to cardiac surgery, which is very exciting because not only am I repairing or replacing one valve, I could apply to 2 valves, to 3 valves, congenital heart defects, arrhythmias, bypass surgery, and even replacing the ascending aorta. I'm proud to say I was one of the first in the world, or the first in the world, to perform the replacement of so when you have an aneurysm,
right?
You've heard that when, people die from that. So today we're able to do this operation, obviously before it becomes an emergency, to ultimately save people's lives and have them live a normal life.
It's amazing.
Yeah. And what minimally invasive surgery does, it allows less time and less...
It's a small incision.
Small incision.
For people like me that don't know,
right.
How is it?
A tiny incision between the ribs on the right side or lateral to the breast tissue.
Right.
You go in, it's about a 4 or 5 centimeter incision, so less than 2 inches. Very minimal spreading of the rib, so we can see the entire area of focus. So we don't see the entire heart, but just the areas that we need to work in, which is because, today we have so much imaging, meaning echoes and CAT scans and all different 3D imaging that we could see the entire heart before we do anything to it. And we know exactly what needs to be done.
And is AI playing a role in all of this nowadays?
Well, AI will definitely play a role in the future. I mean, it's at its early stages, but AI right now is very important for detection of disease,
other things,
and also for planning intraoperative strategy as well as the postoperative care of the patient.
Exactly. And how many patients do you see annually? I know it's a lot. I've read about it.
Yeah. Well, the average heart surgeon in the country performs about 150 open hearts a year, and I have the privilege of performing about 700 heart surgeries a year.
So it's magical hands, and I think you have to, insure your hands.
Yeah. Well, I always say that I'm privileged that the patients.
God gave you a gift. God gave you a gift.
And my goal every day when I wake up is to save lives, do better each day, and to advance the technique so the patients will continue to do better. I mean, this is only, for me, I think it's only the beginning.
Yes.
I think I'm not at the prime of my career yet, believe it or not.
I'm like you.
And exactly.
We're just starting.
Yeah. Just starting. I think, the sky's the limit.
Because you have a passion and you love what you do.
Absolutely.
So Dr. Lamelas, this is a business minute. This is like 5 minutes. I could be here talking with you like for 10 or 15.
Yeah.
There's so much information to give to the members, but time is of the essence. And Mark is talking the conference. And thank you so much for driving all the way from Naples with your lovely wife to be here today. And we'll see you all next week. Thank you for tuning in to another episode of Business Minute with Lily Lopez.